That is Dr. Bedu Sarkodie there with an update on the nationwide poliomyelitis vaccination that's started today. They're looking to touch about 2 million children with that vaccination. Well, talking about health, let's talk about coronavirus. It rose, the number of deaths rose by 136, pushing the nationwide death toll to 2,004. That's according to Chinese National Health Commission. And at least 132 of those deaths happened in the Hubei province, where some Ghanaians have been calling for evacuation. Well, Foreign Affairs Minister Shelia Yakobochi says the idea of evacuating Ghanaian students from the epicenter of that virus, which is Wuhan, came from government. But some challenges have for now made the plan impossible. Speaking during an interaction with the leadership of the National Union of Ghana Students on the matter, she stated that government understands the situation of the student and is.
Our embassy have not something that they speak to us online. And also, as we speak, it is on the way coming with the second batch of 8 students in Wuhan. So at least if the Minister of Foreign Affairs will place call to, for instance, the Prime Minister of Ethiopian Airlines, they are running 5 flights to China in a week. Egypt have done it. Morocco have done the evacuation. So I think a Pan-African cooperation could solve some of these challenges, where our president takes the lead instead of the embassy in Beijing to do. So we believe that if the president is having a political will, then definitely there will be a way. For instance, Saudi Arabia came to Wuhan with a big aircraft to evacuate 10 students. Just 10 students. They should tell us the truth. That is it. Poorer countries.
What is the truth that you want to hear? What is it that you want to hear? What's that truth? You think somebody is lying?
They basically don't want to evacuate us. That is what, because
why would they not want to? Because you're all citizens of Ghana.
Mama V, you see, this is not only about medicine or medical something. It's about our dignity. It's about our life at stake. So we believe that if other countries are doing it, Ghana can do it. It's not a matter of having aircraft or having a national aircraft. The health experts have advised the president that we have been told that they don't have the facilities back to quarantine us. But we all know that 270 people who have been evacuated can quarantine, we can be divided. So we realize that whenever we counter their excuse, they come out with something new. Last week, they said they don't have facility. So we came out with the idea that then it will divide us into groups. And now they are coming out with a new excuse. So they keep shifting the goalposts. And the atmosphere here, we don't do academic work. We have started academic work. The universities have advised people to stay for their own safety and study online. So the Ghanaians here have to study at such an environment. We can't even talk to our parents because when we tell them the situation here, there are a whole lot of back. Our parents' BP are high. We are disappointed and very helpless because the city is locked down. As a matter of fact, I can't get out of my hostel. I'm locked down. I'm basically at house arrest. So though our parents have provision for us to come we.
Sincere apologies for that slight inconsistency in the sound there, but you do get the point that he's making. He says they are still distressed about the situation. He is Michael Adney. We spoke to him earlier from China. In the meantime, the Ghana Health Service says that's taking delivery of PPEs from the WHO in support of the country's preparedness of the novel coronavirus. The presentation was made by the country director of the WHO.
Preparedness is something that needs to be supported by all partners. So WHO has been supporting the government in terms of providing guidelines, not only in Ghana, but globally, providing guidelines in the area of case management, IPC, on ports of entry, on lab. And we know that as part of preparedness, health workers are the ones who are usually at the forefront and the first ones to meet cases. So it is important that they have personal protective equipment. So WHO today is donating some personal protective equipment as part of support to the preparedness. It includes gowns, masks, goggles, and respiratory masks and other types of masks. All this, we believe, will help towards supporting the current government efforts, adding to what the government has already begun to support. So I would like to hand this over on behalf of WHO.
Nation. Indeed, there were few PPEs within the country at some strategic areas. Immediately, we had the red alert indicating that the coronavirus has been confirmed and declared public health emergency of international concern. Immediately, the ministry took steps and procured some more quantities, 5,000 and later, I think, 5 more thousand. So that preparation and preparedness was the initial stage. We have not confirmed cases yet, but we have not, or we about 21 suspected cases, all have tested negative. We need more PPEs so that the staff, the areas that we place them, if we have to stretch out to more areas. And then we also need to do more drills with regards to as part of our preparedness. Should there be any case confirmed, the various teams that have to work together, how do they galvanize the courage, the desire to go ahead and address and treat the cases? So with the needed training, with the needed PPEs, and if the staff know how to use it well, with the understanding that you can handle the cases without any risk to that individual, the various staff would, and then other frontline health workers will have the courage to do more and protect ourselves to handle any suspected, probable or confirmed case.
Okay. So where are these ones going at the moment?
We have our stock. You have a distribution list. So you look at the needs assessment and areas that we have to send them. Immediately, we haven't deployed and just giving them out. We haven't this where exactly to go, but then we are aware that there is a gap in our preparedness. So we use this to address some of the gaps. Mostly the National Rapid Response Teams, the Regional Rapid Response Team had enough of this. Some of the facilities, we've started giving some quantities to them, about 100 to 200 to most of those areas.
So which facilities in particular are we looking at?
All the big hospitals, all the areas that are designated for treatment. So we mentioned Rich Hospital, we mentioned Timaya Hospital, and then all the 10 the former regional hospitals, and then all the teaching hospitals, the association, the Ghana, the private medical providers, the Christian Health Association of Ghana, any group of health providers that we realize that potentially they may handle some of the cases. We have given them some of the supplies in limited quantities. So this will help us give them more as expected and required.